East Tennessee Children's Hospital is a 152-bed pediatric hospital located in the heart of Knoxville, Tennessee, in the Great Smoky Mountains foothills. We serve the entire East Tennessee region from Johnson City at the eastern tip of Tennessee to the Cumberland Plateau in Middle Tennessee, and from the Kentucky border to the north and Georgia to the south. We care for seriously ill children in a unique pediatric environment, and we offer many pediatric subspecialist services. Children's Hospital works with the University of Tennessee Medical Center, the area's level 1 trauma center, to ensure that injured children receive trauma care at the institution most appropriate for the child's needs. We operate 14 pediatric primary care offices throughout the region, as well as 3 pediatric urgent care centers, an outpatient pediatric rehab center, outpatient surgery centers, and pediatric home health units. Plans are underway to open our 4th pediatric urgent care center in the fall. So while our main hospital campus is in Knoxville, we operate several campuses around the region, and the fluidity of these offerings made it a challenge to keep up with all of our locations on the website and to present a unified health system online. When I started in the marketing department at Children's Hospital about 3 years ago, I was the first staff member to hold my position in several years. The hospital's original website was custom designed, but extremely specialized, and the designer was pretty much the only one that really knew how to edit it. When that person left, a CMS development company was commissioned to build a new site, but lack of experience with web design on the staff, plus some poor communication all around, resulted in a website that was functionally frustrating, offered less than optimal support, and ultimately didn't fulfill the goals of the organization. So a big reason for this disconnect was that the most recent CMS developer wasn't healthcare specific. They showed competence in general sense of web design, but didn't possess an expected level of healthcare knowledge and a digital healthcare communication background. In addition, a lot of the administrators and especially physicians weren't happy with how our Find a Doctor worked and was presented. And as we all know, when docs talk, people listen. And this was a big driver in the decision to hire myself, a full-time web specialist. And when I took on that role, assessing the current site and moving to a new vendor was one of my first and biggest priorities. So selecting Geometric was a no-brainer for me from the beginning. They had been in the mix of healthcare CMS companies' decisions in several of my previous positions. And so when it came time to select a website CMS, I was already quite familiar with their business process, the quality and the experience in the field of digital healthcare communication. When we began working with Geometric, we specified several goals for a website redesign. First, we wanted to expand our reach beyond Knoxville and Knox County and the surrounding counties. The entire East Tennessee region encompasses 36 out of Tennessee's 95 counties and a population of almost 2.5 million people. We have a dedication and responsibility to reach every child in our region, and we want to make sure we're thought of as East Tennessee's own children's hospital. Second, we wanted to inspire confidence in all the parents and supporters in our area and our organization's level of expertise, and our commitment to quality healthcare and our superior staff by presenting ourselves in the most favorable manner online we can. We needed to increase our visibility and the quality of information about our programs and departments and specialties. And a big goal was to improve the general user experience and make it more pleasing to all of our audience. Better navigation, easier to find doctors, services, and locations, and of course, responsive design to be used on mobile devices. They were all important upgrades that we needed to have made. The old site was not very responsive and not mobile friendly. And finally, we needed a more robust provider directory to let our doctors shine. And then we needed to be able to present to our administration and stakeholders, as well as ourselves, a unified digital strategy and direction. Continuing to integrate all the areas of our marketing strategy together is an ongoing goal. So here's our new site, and it's built on Vital Site CMS. It's responsive, it's fast loading, and it's been active for a little more than a year now. We actually went live last February of 2020. In fact, less than a month after our launch, we all went into lockdown. So it's been a very interesting first year to evaluate how well the website has performed. I'm going to show you a few highlights, and this is one of the things that we're most proud of. We feel like as a children's hospital, we have a responsibility to treat the mind and the soul of the child as well as to heal their body. For a person just starting out in life and very apt to find hospitals a big and scary place, our leaders over the years have incorporated a large number of sponsored art projects from the community to be displayed throughout our facilities, collectively referred to as the Art of Healing Project. It's created to appeal to a child's perspective. These art projects are colorful, whimsical, and hopefully evoke a smile or a laugh from all that experience them. So from the very beginning, we wanted to incorporate these unique signature art elements into our site design. And we were fortunate that not only does Geonetric employ talented designers, they have staff who have great artistic talent as well. They were able to create these design elements using photographs of various select pieces and use them as design elements. On the right above, you can see two of these art pieces that are displayed inside our NICU. The bottom is a balloon representation called Afloat, and you can see how it evolved from a photo to a sketch to a realized graphic design. The other one on the top is one of my personal favorites. It's a floating paper castle called Just Imagine. And you can see how it evolved into a call to action box. Here's another example, a wood and steel sculpture entitled Bluebird Atrium. It's also in our NICU. It's been reimagined to accompany a section of text on the homepage that introduces users to the hospital and invites them to learn a little more about us. And I think this was actually our proof of concept when the first redesign or design example was presented to us. They provided this particular sketch. The Whimsy, I call it the Whimsy Project. It was spearheaded by the talented Bree Lovelace at Geonetric, and I can't say enough about her artistic talent, being able to take these photos and transfer them to digital elements. And we have another one called the Eureka Kinetic Machine. It's a gift from the Discovery Channel. We have a partnership with them since they acquired the Knoxville-based Scripps Networks, which is the home of HGTV and Food Network, among others. And this contraption is actually located in our outer lobby. And when it's activated, it moves a number of little balls around and is extremely enjoyable to watch. Unfortunately, it's also quite loud and on occasion not very accurate in its ball tossing. But when you see it in action, you are mesmerized. And anyone who enters the hospital through the main lobby passes by, so it's very recognizable. Okay, as I mentioned above, we are in a period of expansion across our area, going from 2 to 3 campuses last year and soon to 4 main health center campuses. It's very important that we make it very convenient for users to find all of our locations. From our urgent care centers to the 14 pediatric offices we own and operate, we worked hard to get these posted correctly, especially since several of them serve underserved areas. And we want to make sure parents don't have to drive an hour to get a great pediatrician for their children. The old Find a Doctor functionality was vital to be redesigned, and our new physicians directory is now meeting all of our needs. The website imported entries from our credentialing directory, and we work with their office to make sure all the provider listings are accurate and up to date. And we have several search criteria to help users pinpoint their searches, and the resulting profile page includes not only an interactive map to the doctor's location and all their specific information, it all gives us a space also gives us some space to list instances where they have appeared in local media discussing pediatric health topics of interest to the community. We also can post videos of them that we have taken of them talking about their experiences and particular health topics. It's very interactive, it's intuitive, and it's easy to customize. And our content, we work carefully with each department in the hospital, and they each reviewed their own pages for accuracy and completeness. And this was another reason for redesign. When our first site was created, or the most recent one, a great deal of the copy was boilerplate department and treatment info from other sites. The content was not customized to us, and on occasion even included information on procedures and equipment we didn't really use. So our folks at Geonetric worked with each department to rewrite the page information for accuracy and clarity. A side benefit of this, and I'll talk about this a little bit later in our tips, was a closer relationship between our department and between those departments and our marketing department. In some cases, there had been rarely any direct contact or interest in promoting their procedures that they do. So the website redesign project helped to increase the hospital's overall visibility. So like I said, the site went live in February of 2020. So COVID has impacted all of our stats in good ways and bad. Some of our big events were postponed, as I'm sure many of yours were. Our annual Fantasy of Trees event is the absolute highlight of the holiday season in Knoxville, and we were unfortunately forced to cancel it in 2020. It was doubly unfortunate for our website traffic because annually during the months of November and December, the Fantasy of Trees typically generates about 14% of our annual site traffic. With info on the event, the activities, presenters, and entertainment, etc. This year, the new website helped manage multiple online events that were held instead. And while we didn't quite meet the numbers that we have in the past, they helped us maintain a level that was comparable. So if you can see from our stats from quarter 4, there was a 157% increase in sessions to the services area, which was primarily due to organic search traffic nearly doubling. And finally, my tips for a successful redesign. Number 1, shore up your communication with every department. If you're at the beginning of the process of converting, make sure you shore up your communication by finding the right people to talk to. Who has that information? Do it early so you're ready. We were lucky. Everyone was on board, even our C-suite. And it was a couple of people in marketing helped me gather the content. And because the scope of our system is relatively small compared to other multi-hospital systems, it wasn't quite as challenging, but as we discover, every nook and cranny of the hospital needs to be represented, so it was still a challenge. Second, the system, find an easy to use platform, and VitalSite and Geonetrics certainly is there. And it was something I was very comfortable with. Also, attend the webinars like this one every month to get information on digital healthcare marketing. And finally, design to your audience, and don't be afraid to bring your culture into your design. Nobody wants a corporate site. Take some time and creativity, experiment, and show off what makes your culture special. That was the driving force behind our art project, is that we wanted to be able to show that we're a children's hospital and we meet the needs of children all across the board, and our art projects did that.